Orthodontic treatment is done in Australia according to the education and training of the specialists. It's done after the age of 10. And the main reason, I think, is simply that the teeth don't come through until after the age of 10.
But Doctors Mew and Mahony would argue that it is imperative to treat them at a young age because that's when they're growing. That's where they can change the mouth structure and the jaw structure.
Once again, you've got one or two people going against the rest of the orthodontists in the country who think that a few people should be treated early. Probably most people should be assessed early to catch the few, and the rest should be followed closely and treated at the most appropriate time, which turns out to be later.
It's very easy to have a production line in orthodontics where everyone comes in at a certain age, has a certain number of teeth out, and goes through the orthodontic process. I think a lot of traditional orthodontists aren't used to dealing with young children, and as a result it's a far easier approach for them to deal with the mainstream 14-year-old extraction type case.
What, young kids just put in the too hard basket?
Absolutely.
Is patients' welfare being compromised here?
I think patients' choice is certainly being denied, and ultimately patients' end results aren't as good as they could be. I'm saddened for the profession to think that there's so many people who aren't willing to offer their patients at least a choice.
It would be slightly better if her cheeks were a little fuller, like that.
Dr Mahony and Dr Mew are by no means alone in this crusade, but they're battling against a powerful establishment.
It's amazing. If you challenge conventional orthodoxy, you will be resented. It's a lot of all those who try and change the system.
And even if the traditionalists don't agree, Dr Mew says his results speak for themselves.
I must say I've been amazed how deeply resented I am at times. I mean, I've even been threatened with assault at meetings. People hate me with a depth that's really quite surprising.
Ultimately, though, perhaps we should leave the final judgment to the patient, like the now not-so-identical twins, Ben and Quentin. After all, they have to live with the results.
I'd definitely go for Mr Mew's method. Yeah. Would you? Yeah. I think if I had the option again, then I would go for Mr Mew's method. And the fact that, yeah, it does give better results. Quentin got the better deal. His treatments, obviously, without the extractions, he's got a better features. He's more pronounced, and mine are less pronounced and a smaller smile.
How do you go with the girls then? You say that Quentin has a better smile.
He may have a better smile, but it's all the chat up and everything else. It's not just the facial features that counts.
Before we go, a word on our website. Standing by now to answer your questions is orthodontist Dr Derek Mahony from Our Straight Talk Story. Our address is 9msn.com.au, then go to the 60 Minutes site.
And just when you thought it was safe to dive back into the mailbag, Jules. Peter Overton's report on the Great Australian Smile and the extractions, physical and financial, so many of you go through. It's painful, expensive, and maybe unnecessary.
Last year I saw 163 people for second opinions. And of those 163, we were able to treat all without extractions.
And what had they been told by the traditional orthodontists?
They had been told that they needed at least 4 teeth out and possibly then the extraction of their wisdom teeth after treatment. So that's nearly 8 teeth.
I'm a general dental practitioner, and I absolutely agree with Dr Mahony that patients who undergo orthodontic treatment have teeth extracted. I was delighted to see your program because perhaps now parents will start asking more questions about treatment offered to their kids. Take them out, don't take them out. For some, it's all too hard. Why don't people accept that what they're born with is what they're meant to have, and that interfering with nature is not necessarily free from unwanted side effects?